Welcome to Explain, a series of health education programs published by the Patient Education Institute, the leading provider of interactive health education. This video includes general medical information and does not replace the medical advice of your doctor or healthcare provider. If you have questions pertaining to your medical condition, ask your doctor or healthcare provider.
Typhoid fever. Introduction. Typhoid fever is an illness caused by bacteria. It spreads through contaminated food and water. Typhoid fever is most common in developing countries. Over 21 million people worldwide get it every year. Without medical care, typhoid fever can lead to death. This program explains typhoid fever. It covers symptoms and causes of the condition. It also discusses treatment options and prevention. Typhoid fever. Typhoid fever is an illness that is caused by bacteria. Over 21 million people worldwide get typhoid fever every year. The bacteria that cause typhoid fever are only carried by humans. The bacteria are found in the feces of infected people. Feces are also known as poop. When food or water is contaminated by feces, the bacteria can spread and infect other people. Typhoid fever is most common in developing countries. You are more likely to catch typhoid fever if you are living or traveling in Asia, Africa, or Latin America. Symptoms. Early symptoms of typhoid fever may include a fever that may rise to 104 degrees Fahrenheit, 40 degrees Celsius, a rash on your abdomen or chest, diarrhea, headaches, weakness and tiredness. Symptoms of typhoid fever get worse as the illness continues. You may also develop the following symptoms after a few weeks without treatment. Confusion, rapid weight loss. High fever and diarrhea can also cause dehydration. Symptoms of dehydration include dry mouth and tongue, few or no tears when crying, urinating less, sunken eyes. Untreated typhoid fever can lead to health complications and death. Early treatment will usually make recovery easier. Contact your healthcare provider right away if you have symptoms of typhoid fever.
Sponsored by the Patient Education Institute. www.patient-education.com. Over 5,000 videos and interactive tutorials.
Causes. Typhoid fever is caused by bacteria. The bacteria can spread through contaminated food and water. When people come into contact with contaminated food or water, they can catch typhoid fever. Once the bacteria that cause typhoid fever are in your body, they travel into your intestines. The bacteria then spread through your blood. Some of the bacteria leave your body through your feces. If a person who is infected doesn't wash their hands after using the bathroom, they can spread the bacteria that cause typhoid fever. You may get typhoid fever if you eat food handled by someone with typhoid fever. Sometimes people recover from typhoid fever but still carry the bacteria. The bacteria can still be found in their feces. These people are called carriers. Even though they no longer have symptoms of the illness, they can still spread typhoid fever to other people. Diagnosis. Your healthcare provider will perform a physical exam. They will ask you about your medical and travel history. Your healthcare provider will need to test a fecal or blood sample to diagnose you with typhoid fever. It usually takes 2 to 3 days for the test results to come back. If your healthcare provider finds the Salmonella typhi bacterium in your blood or feces, you will be diagnosed with typhoid fever. Treatment. Typhoid fever is usually treated with antibiotics. Antibiotics are medicines that fight bacterial infections. They can help kill the Salmonella typhi bacteria in your body. Your symptoms will usually improve in 2 to 4 weeks, but keep taking your antibiotics even if your fever goes away. Symptoms can still return up to 2 weeks after your fever leaves. Follow your healthcare provider's instructions on how long you should take your antibiotics. You may be dehydrated because of the high fever and diarrhea caused by typhoid fever. Drink lots of water while you recover. Oral rehydration drinks can also help replace lost fluids and salts. If your dehydration is severe, you may need treatment in a healthcare facility. Intravenous or IV rehydration is a treatment where fluids are injected directly into your veins. Wash your hands after you use the toilet to avoid spreading your typhoid fever to others. Prevention. Typhoid fever is not common in North America, Europe, Russia, Japan, and Australia. If you live in a developed area, you usually do not need to take any special precautions against typhoid fever. Typhoid fever is common in the developing world. Consider getting a vaccine if you are traveling to Africa, Latin America, or Asia. You will need to get your vaccination at least 1 to 2 weeks before you travel. This will give the vaccine time to start working in your body. If you live in a country where typhoid fever is common, consider getting a vaccine if any are available. Typhoid fever vaccines will lower your risk of getting typhoid fever, but they do not always work. There are other things you can do to help prevent it. To prevent typhoid fever, buy bottled water or boil your water for 1 minute before you drink it. High heat helps kill bacteria. Ask for drinks without ice. Use bottled or boiled water to brush your teeth. Use clean kitchenware and cooking tools. The following can also help you avoid catching typhoid fever. Avoid raw fruits and vegetables that can't be peeled, such as lettuce or berries. Peel fruits and vegetables yourself after washing your hands. Thoroughly cook foods before you eat them. Wash your hands with soap and bottled or boiled water after going to the bathroom, before eating or preparing food, after caring for someone with diarrhea. Scrub your hands with ash or sand if you do not have soap. Rinse with bottled or boiled water. You can also use an alcohol-based hand gel if you do not have soap or water.
If you like this video, please like and share. For similar videos, subscribe to our channel.
Summary. Typhoid fever is an illness that is caused by a bacterium called Salmonella typhi. Over 21 million people worldwide get typhoid fever every year. It is most common in developing countries. Typhoid fever is spread through the feces of infected people. When food or water is contaminated by feces, the bacteria can spread and infect other people. Symptoms of typhoid fever may include a fever that may rise to 104 degrees Fahrenheit, 40 degrees Celsius, a rash on your abdomen or chest, dehydration, diarrhea, headaches. It is important to get treated for typhoid fever as soon as you notice symptoms. If left untreated, symptoms may continue and worsen for weeks or months. It could also be life-threatening. Typhoid fever is usually treated with antibiotics. You may also need treatment for dehydration. With treatment, your symptoms should improve in 2 to 4 weeks. Prevent spreading typhoid fever to others by washing your hands after you use the toilet. You can prevent catching typhoid fever yourself by getting a vaccine. A vaccine is not 100% effective against typhoid fever. You can prevent typhoid fever by drinking bottled water, avoiding raw fruits and vegetables, and washing your hands often. These safe practices give you a better chance of staying healthy. Thank you for using Explain.